I am a second year nursing student at ACU. This presentation will focus on polycystic ovarian syndrome, commonly known as PCOS. We will explore its epidemiology in contemporary Australian society, including its prevalence and risk factors. We will then delve into the pathophysiology of the condition and the way in which it impacts hormonal balance. Shortly after, I will discuss pharmacological treatments that are available to manage PCOS, as well as nursing care plans that can be implemented to support patients in both clinical and community settings. Polycystic ovary syndrome is a hormonal disorder that disrupts normal endocrine function and affects approximately 1 in 8 Australian women of reproductive age, with up to 70% of cases remaining undiagnosed worldwide. Despite its significant impact, PCOS is underreported and comparatively under-researched in Australia. The estimated incidence of PCOS in 2019 was 9,496 cases with a 95% uncertainty interval, ranging from 5,729 to 14,898, indicating the range in which researchers are 95% confident the true figure lies. The midpoint estimate of 9,496 is considered the most likely value. Geographically, disparities are evident, with studies in Western Australia, Victoria, and the Northern Territory reporting prevalence rates of 15.3% to 26% among Indigenous women, substantially higher than the general Australian population for whom comparable data are scarce. Risk factors for PCOS include family history, obesity, and poor dietary habits. Physical inactivity further contributes to metabolic disturbances such as insulin resistance, hypertension, and dyslipidemia, which can exacerbate the condition. Women experiencing uncontrolled weight gain and metabolic dysfunction in adolescence are considered particularly at risk of developing PCOS. On a broader scale, PCOS poses a significant public health challenge in Australia, costing the health system at least $400 million annually, a figure that, while lower than the United States at $5.39 billion, nonetheless represents a considerable economic and health burden. PCOS is characterized by a series of mechanisms that cause irregular hormonal function. The condition is driven by a combination of high androgen levels and insulin resistance, which affect women in varied ways and explain the differing clinical manifestations. Dysfunction of the theca cells and the hypothalamic pituitary ovarian axis leads to excess androgen production. These elevated androgen levels disrupt the normal release of gonadotropin-releasing hormones, which regulate the follicular environment in the ovaries. As a result, luteinizing and follicle-stimulating hormones are altered, further increasing androgen production. At the same time, insulin resistance, influenced by both excess androgens and genetic predisposition, promotes abdominal fat accumulation and worsens metabolic dysfunction. Normally, the pituitary gland secretes luteinizing and follicle-stimulating hormones to regulate androgen production. In PCOS, elevated LH and insulin stimulate testosterone production, contributing to hirsutism, as higher androgen levels promote excess hair growth in male pattern areas. Insulin resistance also predisposes women to obesity, as hyperinsulinemia encourages fat storage and further metabolic disturbance. Disruption of the hypothalamic pituitary ovarian axis additionally interferes with the follicle maturation, preventing ovulation. Without the release of an egg, menstrual cycles become irregular or absent, while the persistence of underdeveloped follicles forming cysts reinforces this dysfunction. Together, these interrelated mechanisms underpin the hormonal, reproductive, and metabolic manifestations of PCOS. From a patient care perspective, it is important to view these issues on a molecular level. Hirsutism results from androgen excess stimulated by insulin. Irregular periods arise from disrupted ovarian signaling, which makes the follicular environment incapable of ovulating. And insulin resistance combined with obesity increases long-term risk of diabetes and cardiovascular disease. Care should include lifestyle changes such as diet and exercise, medication adherence to improve insulin sensitivity, and monitoring symptoms related to hormonal imbalance. A medication that is commonly used to treat PCOS is metformin. It is a biguanide anti-hyperglycemic medication. The mechanism of action involves inhibiting the liver from utilizing non-carbohydrates to produce excess glucose, which in turn improves insulin sensitivity. The indications for this medication include type 2 diabetes, PCOS presenting patients who have indicated insulin resistance, impaired glucose intolerance, and metabolic syndrome. Contraindications for this include renal impairment and acute or chronic metabolic acidosis. Some nursing considerations involved with this medication include assessing renal function before and during treatment, explaining potential side effects of nausea, stomach pain, bloating, and diarrhea, which often go away after the first 4 to 8 weeks of starting the medicine, explaining potential lactic acidosis, which can cause symptoms of muscle pain or weakness, and assessing menstrual regularity and metabolic parameters like the BGL. An acute issue that often arises with PCOS is irregular periods due to hormonal imbalances, which lead to clinical symptoms such as prolonged, missed, or heavy bleeding, contributing to anemia and hypovolemia, which often requires hospitalization. A goal that is involved with this includes, by 3 months, the patient should be able to demonstrate regular menstrual cycles or effectively manage irregular bleeding as monitored and reported by the patient. Some interventions that can be used include health education, which involves tracking cycles and identifying abnormal bleeding, providing medication education, which leads to medication adherence, and the promotion of lifestyle changes, including exercise and diet. Women with PCOS often experience hormonal imbalances due to dysfunction of the hypothalamic pituitary ovarian axis. This contributes to issues such as irregular cycles that can cause heavy and prolonged bleeding, which often leads to anemia or hypovolemia. This is further exacerbated by insulin resistance and excess androgen production, which leads to a variety of additional complications. A key nursing intervention that can be used to mitigate these issues is patient education. This involves making sure that patients fully understand the relationship between hormonal dysregulation, abnormal bleeding, and treatment options. By targeting health education, several nursing interventions can be utilized in terms of providing an in-depth understanding of the pathophysiology in relation to its clinical manifestations. Additionally, highlighting the link between medication adherence and the betterment of the condition will naturally promote adherence. Finally, encouraging lifestyle changes in terms of staying physically active and opting for foods that are high protein and highly nutritious will work to guide effective nursing care. These are all interventions that can be taken into consideration when addressing the acute issue of irregular menstruation in relation to PCOS.